Take a deep breath right now. Go ahead. Did your chest rise? Did your shoulders lift slightly? If so, you're breathing the way most people over 60 breathe. And here's the thing. It's not the way your body was designed to breathe. It's shallow. It's inefficient. And it's quietly robbing you of energy, stamina, and independence. This isn't something doctors usually talk about during checkups. It's not a disease. It's not even a diagnosis. But it affects millions of older adults every single day. You might notice it when you climb a flight of stairs and feel winded halfway up, or when you're playing with your grandchildren and suddenly need to sit down to catch your breath. Maybe you wake up tired even after a full night's sleep, or you feel anxious for no clear reason. These aren't just signs of getting older. They're signs that your body isn't getting the oxygen it needs. And the frustrating part? Most seniors don't realize their breathing has changed. It happens so gradually over years that it feels completely normal. You adjust. You slow down. You assume this is just what aging feels like. But here's the truth. Shallow breathing isn't inevitable. It's reversible. And today, you're going to learn a simple technique that can expand your lung capacity, boost your energy, and help you feel stronger and more confident in your body again. This technique doesn't require any equipment. You don't need to be fit or flexible. You could do it sitting in a chair, lying in bed, or standing at the kitchen counter. And it works at any age, whether you're 65 or 85. The best part? You'll start noticing improvements within just a few days. Your breathing will feel deeper. Your body will feel lighter. And those everyday activities that leave you breathless, they'll start to feel easier again. So if you've been blaming your age for feeling tired, weak, or out of breath, I want you to pause that thought. Because what you're about to discover isn't about accepting limitations. It's about reclaiming capacity you didn't even know you still had. Your lungs are capable of so much more than you think. And by the end of this video, you'll have the exact tool you need to unlock that potential. Let's begin by understanding what's really happening inside your body as you age, and why most people over 60 are breathing in a way that quietly weakens them every single day. Your lungs at 60 aren't the same as they were at 30. That's not a bad thing. It's just biology. But understanding what's changed is the key to fixing the problem. So let's talk about what happens inside your chest as you age in a way that makes sense without all the medical jargon. First, your lung tissue becomes less elastic over time. Think of a rubber band that's been stretched for years. It still works, but it doesn't snap back the way it used to. Your lungs are similar. They can still expand and contract, but they lose some of that natural bounce. This means that even when you breathe in, your lungs don't fill as completely as they once did. Second, your diaphragm, the large muscle underneath your lungs that's responsible for pulling air in, starts to weaken. If you've spent decades breathing shallowly or sitting with poor posture, that muscle hasn't been working very hard. And just like any muscle you don't use regularly, it loses strength. A weak diaphragm means shallow breaths. Shallow breaths mean less oxygen reaching your cells. And less oxygen means less energy, less stamina, and more fatigue. Third, your rib cage becomes stiffer. The joints between your ribs and spine don't move as freely as they used to. If you've been sedentary or spent years slouching forward, those joints can become almost frozen in place. Your ribs are supposed to expand outward and upward with every breath, creating space for your lungs to fill. But when they're stiff, your lungs can't fully inflate. So even if you try to take a deep breath, your chest physically can't open enough to let it happen. And finally, posture plays a huge role. Many seniors develop what's called a forward head posture or a rounded upper back. When your shoulders roll forward and your head juts out, your chest collapses inward. This compresses your lungs and makes it nearly impossible to breathe deeply, even if you try. Your body adapts to this position, and over time, shallow breathing becomes your default. Now here's why this all feels so normal. It happens gradually. You don't wake up one day unable to breathe deeply. It's a slow shift. Year by year, breath by breath, your body compensates. You start using your chest and shoulders to breathe instead of your diaphragm. You take quicker, smaller breaths. And because it happens so slowly, you don't notice. You just think, well, I'm getting older. Of course I'm more tired. Of course stairs are harder. But here's the truth. Age-related changes to your lungs and breathing muscles don't have to limit you the way most people think they do. Yes, your lung tissue is less elastic. Yes, your ribs are stiffer. But your diaphragm? That muscle can be retrained. Your rib cage? It can regain mobility. And your breathing pattern? It can absolutely be changed. You don't have to accept shallow breathing as your new normal. And the technique you're about to learn will prove that to you. But first, let's talk about the everyday habits that are making the problem worse without you even realizing it. You're not doing anything wrong. Let's get that clear right now. The habits I'm about to describe aren't character flaws or mistakes. They're just modern life. But they happen to be the exact behaviors that slowly, steadily weaken your breathing muscles and shrink your lung capacity over time. And once you see them clearly, you'll understand why changing your breathing can make such a dramatic difference. Let's start with sitting. Most seniors spend hours each day sitting down. Sitting to eat, sitting to watch television, sitting to read or use the computer. And when you sit, especially if you're slouched forward or leaning into a soft cushion, your chest collapses. Your diaphragm has no room to move. Your lungs can't expand fully. So even though you're breathing, you're only using the top third of your lung capacity. Do that for hours every day, and your body forgets how to breathe any other way. Then there's stress. Stress doesn't just live in your mind. It lives in your body. And one of the first places it shows up is in your breathing. When you're anxious, worried, or overwhelmed, your breath becomes fast and shallow. Your shoulders tense. Your chest tightens. And if you're living with chronic low-level stress, which many seniors do, especially those dealing with health concerns, financial worries, or loneliness, then that shallow, tense breathing becomes your baseline. Your nervous system stays on high alert, and your breathing never fully relaxes. Mouth breathing is another silent saboteur. Many older adults breathe through their mouth, especially at night. Maybe it's due to nasal congestion, allergies, or just habit. But mouth breathing bypasses your body's natural filtration system and doesn't engage your diaphragm the way nasal breathing does. It also dries out your airways and makes your breathing even more shallow. Over time, it weakens the muscles responsible for deep, efficient breathing. And then there's inactivity. If you're not moving your body regularly, you're not challenging your lungs or your breathing muscles. Walking, stretching, climbing stairs, reaching overhead, all of these activities force your lungs to work harder and your diaphragm to engage. But if your daily routine doesn't include much movement, your breathing muscles atrophy. They lose tone, and your lung capacity shrinks, not because of age, but because of disuse. Finally, there's poor posture, which we touched on earlier. But it's worth repeating because it's so common. If you spend your day with rounded shoulders, a forward head, and a curved upper back, you're physically compressing your lungs. Your rib cage can't expand. Your diaphragm can't descend. And no matter how hard you try to breathe deeply, your body won't let you. Posture isn't just about looking confident. It's about creating the physical space your lungs need to function. Now, I'm not telling you this to make you feel bad. I'm telling you this because awareness is power. Once you understand how these habits are affecting you, you can start making tiny adjustments. And the breathing technique you're about to learn, it counteracts every single one of these habits. It retrains your diaphragm. It opens your rib cage. It calms your nervous system. And it works even if you've been breathing poorly for decades. So let's dive into the technique itself and learn exactly how to do it. The technique I'm about to teach you is called diaphragmatic breathing, but you don't need to remember that name. You can just think of it as belly breathing or deep breathing. It's not new. It's not trendy. In fact, it's the way babies breathe naturally before life and habits change the way we use our lungs. And the reason it works so well for seniors is that it directly targets the root cause of shallow breathing, a weak, underused diaphragm. Let me explain how it works. When you breathe using your diaphragm, instead of your chest and shoulders, you're engaging the largest and most efficient breathing muscle in your body. Your diaphragm sits just below your lungs, shaped like a dome. When you inhale deeply using this muscle, it contracts and flattens downward. This creates a vacuum that pulls air deep into the lower parts of your lungs, the areas that hold the most oxygen. At the same time, your belly naturally expands outward because your diaphragm is pushing down on your abdominal organs. When you exhale, your diaphragm relaxes and moves back up into its dome shape, gently pushing air out of your lungs. Your belly naturally draws back in. It's a smooth, rhythmic, effortless process. And when done correctly, it fills your lungs more completely than chest breathing ever could. Now, why does this matter for seniors specifically? Because most older adults have stopped using their diaphragm altogether. They've been breathing with their chest and shoulders for so long that the diaphragm has become weak and lazy. And when you re-engage that muscle, something remarkable happens. Your lungs start filling from the bottom up instead of just the top. You take in more oxygen with each breath. Your heart doesn't have to work as hard. Your body starts to relax. And over time, your lung capacity actually expands. This isn't about forcing air in or holding your breath until you're dizzy. It's about retraining your body to breathe the way it was designed to breathe. Slowly, deeply, efficiently. And the beauty of this technique is that it's incredibly gentle. You don't need strong lungs to start. You don't need to be in good shape. You can have COPD, asthma, heart issues, or limited mobility, and this technique will still work for you. In fact, it's often recommended by respiratory therapists and physical therapists for exactly those conditions. You also don't need a lot of time. 5 minutes a day is enough to start seeing results. Some people practice while watching television. Others do it first thing in the morning or right before bed. You can do it sitting in a chair, lying flat on your back, or even standing if you prefer. The position doesn't matter as much as the technique itself. And here's what makes this so powerful. Diaphragmatic breathing doesn't just improve your lungs. It calms your nervous system. It lowers your blood pressure. It improves your digestion. It helps you sleep better. It even sharpens your focus and mood. Why? Because when your body gets more oxygen, every system works better. Your brain works better. Your muscles work better. Your heart works better. Everything improves. So if you're ready to feel what it's like to breathe deeply again, to fill your lungs completely and effortlessly, then let's move into the step-by-step instructions. I'm going to walk you through this slowly, clearly, and safely so you can start practicing today. All right, let's do this together. I'm going to guide you through the technique step by step, and I want you to go slowly. There's no rush. You're retraining a muscle that may not have worked properly in years, so be patient with yourself. If at any point you feel dizzy, lightheaded, or uncomfortable, just pause and breathe normally. You can always come back to this later. Step 1. Find a comfortable position. If you're able to sit, choose a chair with good back support. Sit up tall but not stiff. Let your shoulders relax down and back. Rest your hands on your lap or on the armrests. If sitting is difficult, you can lie flat on your back on a bed or a mat, with a pillow under your head and another under your knees for support. The key is to be comfortable and relaxed, but not slouched. Step 2. Place one hand on your chest and the other on your belly, just below your rib cage. This is important because it gives you feedback. You're going to feel which part of your body is moving when you breathe. Right now, just breathe normally and notice. If your chest is rising and your belly isn't moving much, that's chest breathing. That's what we're going to change. Step 3. Close your mouth and breathe in slowly through your nose. As you inhale, focus on sending the air down low into your belly, not up into your chest. Imagine you're filling a balloon in your stomach. The hand on your belly should rise, while the hand on your chest stays relatively still. If your chest is still moving a lot, that's okay. Just keep trying. It takes practice to isolate the diaphragm. Step 4. Exhale slowly through your mouth, as if you're blowing out a candle gently. Let your belly fall naturally as the air leaves your lungs. Don't force it. Don't push. Just let it happen. The exhale should be longer and slower than the inhale. This is what activates the calming part of your nervous system. Step 5. Repeat this cycle. Inhale slowly through your nose for a count of 4. Let your belly rise. Then exhale slowly through your mouth for a count of 6 or 8. Let your belly fall. Keep your shoulders and chest as still as possible. Focus on the movement in your belly. That's your diaphragm working. Now, let's talk about common mistakes because almost everyone makes them at first. Mistake number 1, breathing too fast. This isn't a race. If you breathe too quickly, you might hyperventilate and feel dizzy. Slow it down. Count if you need to. Inhale for 4, exhale for 6. That's a good rhythm. Mistake number 2, forcing the breath. You don't need to take the biggest breath of your life. You're not trying to fill your lungs to bursting. You're trying to fill them efficiently using your diaphragm. A medium-sized breath done correctly is far more effective than a huge gulp of air done with your chest and shoulders. Mistake number 3, tensing your shoulders or neck. A lot of people tense up when they're trying to breathe deeply. Check in with your body. Let your shoulders drop. Relax your jaw. Soften your face. The more relaxed you are, the easier this will be. Mistake number 4, giving up too soon. You might not feel much the first time you try this. That's normal. Your diaphragm is weak. It needs time to wake up. But if you practice every day, even just for 5 minutes, you will feel a difference within a week. I promise. Now, if you're someone with limited mobility, or if sitting and lying down are both difficult, you can do this standing. Just stand near a wall or counter for support. Keep your knees soft, not locked. Place your hands on your belly and follow the same steps. Inhale through your nose, let your belly expand. Exhale through your mouth, let your belly fall. And if you have lung conditions like COPD or asthma, this technique is still safe for you. In fact, it's often recommended. But start gently. Don't overdo it. And if you're ever unsure, check with your doctor or a respiratory therapist. You just learned the most powerful tool you have for expanding lung capacity and improving your breathing. Now let's talk about what happens when you start practicing this regularly. So what can you actually expect to feel when you start practicing diaphragmatic breathing every day? Let's talk about the real, tangible benefits that matter in your everyday life. First, you'll notice that physical activities become easier. Walking to the mailbox, climbing stairs, carrying groceries, playing with your grandchildren. These activities require oxygen, and when your lungs are working efficiently, your body gets the fuel it needs. You'll feel less winded. You'll recover faster, and you'll have more stamina throughout the day. Second, your energy levels will improve. Shallow breathing means your cells aren't getting enough oxygen. And when your cells are starved for oxygen, you feel tired, sluggish, and foggy. But when you breathe deeply and efficiently, your blood becomes fully oxygenated. Your brain wakes up. Your muscles feel stronger. And that constant fatigue you've been carrying around, it starts to lift. Third, you'll sleep better. Deep breathing activates your parasympathetic nervous system, which is the part of your body responsible for rest and relaxation. Many seniors struggle with insomnia or restless sleep because their nervous system is stuck in a state of low-level stress. Practicing diaphragmatic breathing, especially before bed, signals to your body that it's safe to relax. You'll fall asleep faster and sleep more soundly. Fourth, your anxiety and stress will decrease. There's a direct link between shallow breathing and feelings of panic or worry. When you breathe shallowly, your body thinks it's in danger, and your stress hormones spike. But when you breathe deeply and slowly, your body calms down. Your heart rate slows, your blood pressure drops, and your mind becomes clearer and quieter. Fifth, your balance and posture will improve. When you practice diaphragmatic breathing, you naturally sit or stand taller. Your core muscles engage. Your rib cage opens. And this better posture leads to better balance, which reduces your risk of falls. Many seniors don't realize how connected breathing and posture are, but they're deeply intertwined. Sixth, your immune system gets a boost. Oxygen is fuel for your immune cells. The better you breathe, the better your body can fight off infections and recover from illness. And finally, you'll feel more confident and independent. When you're not constantly out of breath, when you can walk farther and do more without stopping to rest, you start to trust your body again. You stop avoiding activities because you're afraid you won't be able to keep up. You start saying yes to things again. And that sense of capability and freedom, It's priceless. These aren't promises. These are patterns that doctors, therapists, and seniors who practice this technique see over and over again. Your body wants to work well. You just have to give it the tools. And now you have one of the most important tools there is. Here's the good news. You don't need to practice this for hours. 5 to 10 minutes a day is enough to see real improvement. And the more consistent you are, the faster you'll notice results. So when should you practice? The best time is whenever you'll actually do it. For some people, that's first thing in the morning before the day gets busy. For others, it's in the afternoon during a break or in the evening while watching television. Some people love practicing right before bed because it helps them fall asleep. There's no wrong time. Just pick a time that fits naturally into your routine. Here's a simple way to build the habit. Attach it to something you already do every day. For example, practice your breathing right after you finish your morning coffee. Or do it during the commercial breaks of your favorite show. Or make it part of your bedtime routine, right after you brush your teeth. When you link a new habit to an old one, it's much easier to remember. Start small. Don't try to do 20 minutes on day one. Start with 3 minutes. Just 3. That's 10 or 12 slow, deep breaths. You can do that. And once it feels easy and natural, add another minute. Then another. Build slowly. There's no rush. You can also practice throughout the day in little moments. Waiting in line at the store? Take 3 deep belly breaths. Sitting at a red light? Breathe deeply. Feeling stressed or anxious? Pause and do 5 slow breaths. The more you practice, the more automatic it becomes. Eventually, your body will start breathing this way on its own, without you even thinking about it. Consistency beats intensity every time. A few minutes every single day will transform your breathing far more than one long session once a week. So commit to showing up, even on the days you don't feel like it. Your lungs will thank you. You've made it to the end, and that means something. It means you care about your health. It means you're willing to take action. And that's exactly the mindset that leads to real, lasting change. Remember, it is never too late to improve your breathing. Whether you're 60, 70, 80, or beyond, your diaphragm can be retrained. Your lungs can expand, and your energy, stamina, and confidence can come back. Here's your bonus tip. Focus on your posture throughout the day. Every time you catch yourself slouching, gently sit or stand taller. Roll your shoulders back. Lift your chest. This simple awareness creates space for your lungs to work and supports everything you've learned today. So take a deep breath, a real one. Feel your belly rise, and know that you've just taken the first step toward breathing better, feeling stronger, and living more fully. You've got this, and I'm cheering you on every step of the way.